Hi, welcome to Heritage Health and Wellbeing webinar. My name is Gemma Channing and I'm from the Beanie House of Art and Knowledge in Canterbury, and I'll be talking to you today about creating digital health and wellbeing content and then moving on to talk about staff health and wellbeing. So the first thing I'm going to do is I'm going to share my screen with you, so bear with me a second, so that you can see the presentation. Okie doke. So thank you everyone for coming. It's been really interesting to see the variety of different people that have joined us today, from education, from healthcare, from the arts, from museums, some artists as well, freelancers. So it's really nice that we've got quite a good cross-section of different people here, so that's great. So as I said, today we're talking about heritage, health and wellbeing. Here's the schedule for the morning. So the first thing we're going to talk about is creating digital health and wellbeing content. So how to take projects that we might usually run face-to-face and run those online. There'll then be a 5-minute break, so you can take some notes, have a cup of tea, and then we'll be moving on to part 2 of the webinar, which is managing health and wellbeing of staff, and that includes yourself as well as a member of staff. We'll then have another quick 5-minute break for taking notes and for you guys to come up with some questions. So anything that I'm talking about, if you've got any questions, keep hold of those, and then at the end, the last half hour will be looking at answering those questions for you. So that's great, thank you. So the first thing that I'm going to talk about is Beanie. So for those of you that don't know, Beanie is a museum in Canterbury. There we are, in Kent, which is in the southeast of England. And we are the Culture, Health and Wellbeing Alliance champion for Southeast museums, which means that we're responsible for sharing best practice in terms of arts and culture for health and wellbeing, and for building networks in the Southeast to enable other museums to work to run programs for health and wellbeing. So we run a very busy health and wellbeing program. So we've got some long-running monthly groups for people with vision impairments, for people living with dementia. We have an art therapist that comes in and she works with people that have a mental health diagnosis. And throughout the year we run a lot of events and different projects for everyone to improve health and wellbeing of everyone, whether they've got an existing condition or not. We like to include everyone in the practice that we're doing. And just to introduce myself, so my name is Gemma Channing and my role at Beanie is the Health and Wellbeing Programme Coordinator. So I help manage all our different projects and looking at sort of accessibility and inclusion and how we can help more people access not just the Beanie but museums in general. So I've interspersed this presentation with pictures from the Beanie and of people engaging in our health and wellbeing activities, just because it's nice to see people having fun in the museum, and hopefully we can get back there soon. So I can't possibly cover everything in one webinar, so there will be time for questions at the end. If not, feel free to email me. I've put my contact details on at the end. So off we go, health and wellbeing digital content. So what are we going to be covering this morning? So we're going to be looking at why health and wellbeing, why it's important, looking at planning content, delivering content, and then planning ahead. So thinking of what happens afterwards, what happens after this period in time when we're open again. How can what we've learned influence practice in future? So the first question really is why cultural institutes? Which is something that I'm asked a lot, which is why should arts and cultural institutes be expected to deliver health and wellbeing services? And we at the Beanie consider ourselves to be a therapeutic museum, so we know that engaging in culture has a positive impact on wellbeing, and therefore as an open community venue, we have a responsibility to facilitate that so that more people can access those benefits of going to museums, going to galleries and other institutions. We're not seen, and we shouldn't be seen, as typical healthcare settings. We're not hospitals, we're not clinics. However, as community venues, we are very well placed to offer health and wellbeing interventions, as we're visited by huge cross-sections of society. And we also have a responsibility to ensure accessibility and inclusion so that everyone can participate and reap the benefits of engaging in cultural activities. So there's a very interesting report here that I shared, and the link will be at the end, that just sort of sums up really why museums, because our doors are open to all people, so we're very well placed. And that we have an important role to play in tackling health inequalities as well. So health inequalities looks at the people that have the best health outcomes and people that have the worst health outcomes, and why that is, and what is it about their unique set of circumstances and their environment that contributes to that. And as museums, we see people from a cross-section of society, so we're very well placed to be able to start conversations about that and what that really means. So moving on. So why health and well-being as a topic? Why health and well-being? So there's a wealth of evidence that engaging in the arts has a positive impact on physical and mental health. So I'll share some of those shortly. What we do know is that engaging in the arts, particularly in interventions that are very carefully and planned and based on evidence, is proven to improve well-being across age groups, across socioeconomic status. It's a continuously growing area and an increasing growing area of research too, and crucially it's also one of the central themes of the Arts Council strategy Let's Create, which they launched at the beginning of this year, and it runs from 2020 to 2030, and one of the key elements of that is health and well-being and the impact of creative activities, museums, galleries, and other arts interventions, what the impact of that will be on people's well-being. As well, it's particularly pertinent at the moment because the population's overall well-being is likely to be affected by current events and what's going on with social distancing and lockdown and everything else that's happening around coronavirus. We're seeing social isolation increasing alongside the sort of economic impact of the virus on households, including redundancies and pay cuts, and the impact that that has on people's well-being. Psychologically, we're seeing increased levels of anxiety and stress, and crucially at the moment it's harder than ever for people to access services. And it's about collaborative practice, so our role is not to replace community services now or in the future, but to have an awareness of what our audiences are experiencing. It helps us to plan better how to engage with them, and working with local health organisations as well to meet those needs. So here's some facts basically about the impact of arts and culture on well-being. So I'm not going to read through all of them. I will send you these slides out. However, you can see, so this is from a selection of scientific research papers. So this is proven benefits of engaging in cultural activities. Social isolation is particularly sort of relevant right now as it's a priority for the government. Even before coronavirus, it was a crisis and a priority for the government. And now with the coronavirus outbreak, it's an increasing problem due to social distancing and the impact that that has on people's health. So the research is ongoing, and it shows clear benefits, not just for improving physical and mental health of the general population, but also that for those living with long-term conditions, it can have benefits to support them to manage the symptoms and the experience of that condition, things such as chronic pain, chronic fatigue, and long-term mental health problems. Our goal is not to cure people or to fix people. Our goal is to help people to make the most of their the situation, the unique set of circumstances that they find themselves in. Which leads me on to my next point, which is that it can be overwhelming for practitioners that are just getting into health and well-being in museums and in galleries to think about what that means and what that practice looks like. And if it is something that you do want to incorporate into your practice, it can be helpful to think of it in this way. That the role of cultural institutions is to create and facilitate an environment where health and well-being can flourish, not to diagnose or treat specific conditions. You don't have to become a health professional in order to deliver activities that are going to improve health and well-being. We're not there to cure people, we're not there to medicate people or diagnose people. And we can't independently solve a global health crisis. It's more useful to see your practice in terms of like one piece of a bigger picture. So we're one strand of improving well-being. So you kind of lift that responsibility from your shoulders. You don't need to cure people or have very in-depth clinical knowledge of very specific conditions. That's not really what it's about. So moving on to the next slide. So planning digital health and well-being content. So a lot of this is kind of project management. So the first part is linking your strategy to your missions and values. So now is not the time to be rewriting your objectives and your aims. Now is the time to go back to what your missions and values are as an organisation and work from there. Work out what your sort of key performance indicators are, and if there are any of those that you can tie in with a health and well-being intervention, rather than trying to squeeze a health and well-being intervention into and adding it into something new. Think of what you've already got and can you transform that to be a health and well-being intervention. The next step is understanding your audience. So I've written a bit there about segmenting audiences, which is it's an art in itself, but it's basically about understanding who your audience is and what they are experiencing at the moment. So there's some good places to start. So one is the audience agency. So they provide a lot of tools on how to kind of understand what's going on locally and how to use that information. So there's a lot of links at the end, but just to kind of cover the key ones. So Public Health Dashboard will provide information about your local area. So you put in your town or your postcode and it will provide information about health behaviours in that area and the impact that that's having on general health. There's also the Indices of Deprivation, which is a government paper which looks at health inequalities and why certain areas are experiencing higher levels of some health conditions and why areas are experiencing lower levels. Again, that's something you can type your postcode into and find out, or the postcode of your organisation, I should say, and find out what unique set of health and social and personal circumstances are your audience experiencing right now. And the reason that you want to do that is to establish, have you got a particular audience in mind that you want to reach? Is one of your core values as an institution that you want to engage with people that have a mental health issue, or is it that you want to reduce isolation? Have you got a particular audience in mind? Because if you do, then you need to find that audience by doing this segmenting and searching, and then you need to establish what their needs actually are. Is it service provision? Is it is it service provision, or is it opportunities, or is it linked up working? Do you need to, are there already a lot of services, but maybe there's something you can do to kind of generate a network so that those services are easier to access? And define your key message. So the simpler the better, really, and be realistic. So when, as I said, you're not going to cure anyone's conditions, or you're not going to take away anyone's anxiety, but you can, as an organisation, provide activities that are relaxing, or you can provide a project that will give people time to spend with other people. Again, that key message needs to link with your objectives and your mission and your values as an organisation, and it needs to be relevant to your audience that you've identified that you want to engage with, and what their needs are at the moment. So once you've got that, once you've got kind of your key audience and your key message of what it is you want to achieve, the next thing to do is identify how you're actually going to deliver that message, how you're actually going to deliver that project, that intervention. So this could be, we're talking about digital here, so this could be on your website, or is it going to be something that you're going to run through social media? Is it something that you want people to submit things to you, or is it something that you're going to output? Are you going to use videos? Are you going to use quizzes? Are you going to use written? Are you going to use photo? Have a thought about what your audience is and what they're likely to engage with. And then consider if there's anything that you can do that's not digital as well. So if you are running a digital project, is there a strand of that that you can run for people that might not necessarily have access to the internet? It's also very important throughout whatever project you run to analyse engagement activity. So how well are people engaging with what you're producing? So it can be done on social media quite easily, because most social media accounts come with basic analytical tools, so you can find out things like reach and engagement, likes and retweets and things like that. The good thing about digital is it provides very quick feedback, so that allows us to be responsive, so you can see what's working and what's not working, and design your intervention in that way. Digital especially needs to be a very dynamic process. There needs to be an allowance that things may change, people may engage in things in a way that you didn't expect, so you need to allow some flexibility in the model of the project that you're designing to allow for changes. Also requesting feedback from your audience, and it is very important to talk to your audience, not least because it shows that we care what they think, but also I'm constantly surprised that people will spend days, weeks, months in meetings trying to work out what audiences want, and the quickest way to find out what different groups need is to ask them what they need. Most organisations have some sort of digital platform, some sort of mailing list where you can ask your audience, what is it that you want? Do you want activities to do? Do you just want to be left alone? Do you want things that you can watch? Do you want things that you can participate in? That's a really simple and effective way of understanding what your audience needs are. And it takes it away from this very kind of top-down approach, and it's a much more like co-created kind of model of working with your audiences. And it demonstrates that you have a genuine interest in your audience, and as well it makes what you're doing relevant. Finally, always consider accessibility. So a lot of people think accessibility means putting a wheelchair ramp on the front of a building, you make it accessible. And I like to think that a lot of us know that it's a lot more complicated than that. In a paradoxical sort of way, some museums and galleries are actually more accessible than ever due to the lockdown. Going digital means that people with disabilities that might not have been able to access our buildings previously have now got access to virtual tours, they've got access to quizzes, activities, they're talking to museum staff, participating in online arts and culture activities, that they have in a way that they wouldn't have been able to previously. So first of all, make it as easy as possible for people to participate by considering accessibility in every stage of your planning. But just as it wouldn't be acceptable to make a building inaccessible by not providing a wheelchair ramp, it's also not acceptable to make your digital content inaccessible by not thinking about people's needs when they're accessing content online. So that's looking at things like how you word the posts that you make online. A lot of people with visual impairments use screen readers that need information to be structured in a certain way so that they can effectively read that. There's a lot of information on making digital content accessible, and I put some links at the end of the slideshow, so we can talk about those at the end. Okay, thank you. Yeah, so this is a note really on if you're hoping to do health and wellbeing practice in your museum, that's great and that's fantastic, and I'm so glad that people are getting more enthusiastic about it. It needs to be evidence-based. So start with why you want to do this. Why do you want to do health and wellbeing practice? Is it because you feel that it's something that's important to your organisation? Is it something that's important to your community? What is it? Why is it that you're doing this? Do you want to improve people's mental health outcomes? Do you want to improve accessibility? Do you want to improve inclusion and provide opportunities for people to meet up more? So think about that, and then thinking about who your target audience is and where they are. And the next step is how. So how are you going to get this project from your mind onto paper into the minds of the people that you want to access it? And one way of doing that is meeting your target audience's needs. So we spoke a little bit about this before, but this is more about kind of, if you want to engage with specific groups of people, you need to look at the research about what those groups of people, what their needs are, what their common experiences are, and what evidence already exists of what works and what doesn't work. So if you want to meet the needs of older people, for example, you're going to have to look at research and examples of best practice of things that have worked with older age adult groups. Whereas if you want to engage with the general public, then you can look at more sort of generalised well-being and how you can incorporate that into your practice. It's very crucial that we measure the impact of any health and wellbeing intervention, whether that's in a building or whether we're online. Not least of all because we want to know that what we're doing is actually having a positive impact and working. But in terms of funding, evidence is key. We need to be able to prove that we are doing what we say we are doing in order to justify receiving public funding. It also adds to the overall sort of evidence base and demonstrates a professional level of practice. And the evidence that what we're doing has a measurable and quantifiable impact on people is a very powerful tool for driving social change and for thinking about future policy and how decisions get made in the future. The evidence that we collect now can be very useful. Ideally, you need to be measuring your outcomes against a goal. So your goal is what we spoke about earlier. So that's what links in with your mission, your values, your audience, and what your overall goal, whether it's meeting health and wellbeing needs, whether it's specifically targeting a particular group or a particular condition. Going digital does reduce some of the tools that we can use for measuring the impact of health and wellbeing, or I should say it changes the way that we can use them. There's a lot of different ways of measuring the impact of arts and culture on health and wellbeing, and well-being generally. A very kind of popular version is the Warwick and Edinburgh Wellbeing Scale, also known as the WEMWEBs, which is an internationally validated standardised tool where people rate on a scale how they feel on a number of different questions. So it can be, some of them are about how if they feel they've spoken to enough people, if they feel like they if they're enjoying their days, if they're enjoying the activities they're participating in, and that will give them a score at the end, which is their wellbeing score. That's a very good tool for if you're doing long-term kind of projects with a particular group of people, because you can take one recording of their well-being at the beginning and one after the intervention, and you've actually got a comparison then, so you can see, has their well-being improved, has it stayed the same, has it got worse, which may happen, and that's not a negative thing in itself because everything's a learning point. As well as these kind of standardized tools, so you can also make your own kind of questionnaires if you've got specific answers that you want people, specific questions that you want people to answer. You can make your own questionnaire Another really powerful tool that I think translates really well to digital is looking at kind of narratives and the more qualitative feedback. So interviews, which is something that can be done very easily on the phone or on video chat, interviewing people about the impact that engaging in activities has had on them. There's also using diaries, so online diaries, online chat boards, online forums, which allow people to express their experience of something without necessarily being constrained by sort of numerical graph kind of data. And that will produce a lot of very rich data and information that you can use to demonstrate the value of what you've done as an organisation and the impact that that has had on the individuals that participated. I mean, the downside of that is that it does take longer. However, it's such a rich amount of information, and it can be really powerful as well, especially in understanding exactly how what you're doing impacts people's personal lives. So I've got some ideas of here of things that you can do as an organisation if you want to start thinking about health and wellbeing activities. So these are based on the 5 ways to wellbeing from Mind, which I'll link to at the end, which, as you can see, so they're connect, be active, take notice, learn and give. And the theory is that if you participate in these activities, all 5 of them on a regular basis, that your health and wellbeing will be improved by it. So connect is, it does pretty much what it says on the tin. It's all about our connections with other people and socialising with other people. Something that's quite difficult at the moment with social distancing, but it's something that is quite difficult for a lot of people, whether there's a pandemic or not. Social isolation is a big issue. And what are some ways that you can, what are some projects you can use to overcome that? So one is online choirs, or online any kind of shared musical or creative experience where people can use video conferencing to do something as a collective. Things like participatory projects, so online exhibitions where people will contribute to be part of kind of a community project. Things like virtual coffee mornings, where even though we can't necessarily physically be together, getting people together in a chat room, give them a topic to talk about and just have a conversation, even though we're not able to get people physically into our museums and galleries. Is there a way that we could digitally run those groups that we would have been running? Be active, again, speaks for itself. Of course, always do it within sort of reasonable common sense, so nothing that's going to injure the people that are watching your video and nothing that's going to injure the person that's delivering your video. So nice kind of gentle things like chair-based exercises, chair-based yoga. You could provide local walking groups, which it links in nicely with your organisation where you sit in the local area. Take notice. So take notice is about kind of being in the present moment and noticing how you feel, what's going on. So some examples of things that you could put out there are mindfulness guides. So there's thousands of these available. You can make them as simple or as complex as you like. Giving people instructions for tasks like meditative drawing, which is a drawing technique that's been used for a very long time now in sort of therapeutic settings, which is, again, there's a lot of different ways of doing it. And it basically encourages the person to focus on what they're doing in that moment of creativity, and it allows them to sort of close out everything that's going on around us. And using art to express emotions as well can be a very powerful tool. Using colour to express emotions, giving people an outlet for their feelings at the moment, which can be a great thing and can be very helpful for people. Learning, so most sort of medium to big kind of organisations will have a learning team. If you haven't, then it's things like online quizzes or presenting your collection online. There's a very interesting Twitter called, the hashtag is Museums at Home, which is all about people that work in museums and galleries choosing an object from their collection and telling a story about it within 1 minute. So if you've got anything sort of particularly unique or weird or strange or something that doesn't come out very often, and can you introduce it to an audience in a new way? And Give is all about, well, it's all about giving. It's all about focusing on other people's needs, which can be very good for our own well-being. So activities that we can do. So participatory projects again. Things where people can give their time, give their ideas, and give back to their communities. So it doesn't necessarily have to be kind of financial giving. It's about giving part of yourself and part of your time to something. So just to kind of round up the key points that we've covered. So making sure that digital health and wellbeing content is relevant to your organisation's overall mission and values, relevant to the audience that you want to engage, it's accessible and inclusive, that it's evidence-based, and that it's measured and evaluated. Just as a final point as well, I've put on there about joining the Culture, Health and Wellbeing Alliance. So they're a national organisation looking at the impact of the arts and culture on health and well-being, not just in sort of museum and gallery settings, but also taking that into healthcare settings. They've got a lot of information on their website about best practice. They've got a lot of toolkits on their website and examples of ways of measuring your impact. And you can sign up to be part of that network for free. Anyone can join. So I'd really recommend that if you're looking for kind of a starting point, that's a really good website, and that's a really good organisation to get started with. So that's it for now from me. So we're just going to have a 5-minute break, and then we'll come back and talk about staff health and wellbeing. So thank you very much.